you not have too better is this your understanding of topics and allow you to do a little bit of research. Discussion forum questions have the same objective. You're supposed to just test your memory. You're not supposed to Google them from anywhere. After you listen to a class like this one, then go and answer the questions in the discussion forum. They should just help you know whether you have understood what you needed to understand from. We have the discussion. So don't be meant to cut off. In every class, we have a question. Semester now to semester so assignments are usually out of 10 and then add your cut 1 and cut 2 and that will form your coursework marks out of 40, and then you can now do your exam be basically out of 60. So that is what will form the basis of that is what is forming the basis of our assignments. It's forming the basis of our assignments. Jacqueline's mic is on. Is it Jacqueline Jenga? But I can't see her on the list. So I'm struggling to get how she's on, but I can't see her on the list of attendance. Let me see why that is the case. Just a minute. Because we need to be together before I start. Our class will not be long. Should be as short as possible. Okay, I don't think there's a problem from this end. All right, so you can go back and check my comments from the discussion from last week. They are open. I'll close them at the end of this class. Also for the discussion forum for this class, there are 2 questions. I urge you to attempt them by 2 p.m. I'll tell the WhatsApp group and I will add it. Our topic today is personality and behavior deviations. Our focus is on understanding why personalities that we call conditions that are not the normal. They are basically not normal. But before that, we need to define what is a personality. A personality of we have depending whether anything the around you as you are growing up influenced who you are. Also, it could be influenced by the work you do. Sometimes we will tailor our behaviors to how the work we do. Sometimes we'll tailor our behaviors to the environment. So, a personality, an individual's personality will be influenced by their environment, their history, basically their history. So for you to understand a person, you need to ask them a little bit about their history and how they behaved in certain situations, which will influence who they are today. You could person that to disorder. So disorder, way of the same as what we expect each other to know. Because if it is need to sometimes you behave in a way simple one but the which is more which is used in our society is called of this disorder will affect you in the way you think about yourself. You've seen some people who have a lot of low self-esteem. Some people are very harsh on others. They are insensitive. We will see all these. So it affects personality disorders affect the way someone thinks about themselves. Someone responds emotionally to something. Someone relates to other people and how you basically control or not control your behavior. So that is what personality disorder. That is how personality disorder affects our daily lives. As we go through these types of personality disorders, I would like to maybe draw your attention to certain people in your life who could be affected by this. One of them is yourself. So you could ask yourself, maybe have you at one point in your life faced any one of these, and maybe how did you solve it? So I would like to draw your attention to that. Now, before even going to that, I would like to mention, before going to personality disorders, I would like to mention there's a question on, do we have types of personalities? Do we? Do we have types of personalities? Leave alone personality disorders. Do we have different types of personalities? This, yes, we do have different types of personalities, but we cannot group them into any simple categories. Some people say there are 16, others say there, we can just say there could be like four of them. Let me highlight just a few here. They are not part of our notes. They're not part of our. Just give me a minute. Let me handle something so that could be causing a bit. Sorry about that. Sorry about. I needed to handle that so that it doesn't affect my work. Okay. Now I was mentioning the different types of personalities, the good kind or the good kind of. We can call them good in our case, and I wish to share just four of them. And so I will stop sharing this screen and share a new one. Okay. We have these four. We have an average personality. This is the most common type, where people are high in neutrality. Some people are very neutral, others are extra, or some people, some people are just neutral and calm in their behavior. Others are what you hear people call extra. It's extraversion. They just, a person has a bit of both, sometimes neutral, sometimes extra. That's average. And you have reserved people. They are not open to a lot of talk. They tend to be introverted. They agree on most things. They consent on most things. Then we have people we call role models. These are natural leaders with low levels of neutrality. They make decisions. They are agreeable. They have extra. They are open. They consent on many things. Then there are people who are self-centered. They focus on themselves. They rank below average on openness. They are not. They are not very agreeable. They do not consent on many things. So those are the four that we have. And so I'll stop sharing that and go back to our notes. Here, just so that I can specific types of personality disorders. The first one we call antisocial personality disorder. It's a pattern regarding others. It's a person who is insensitive to others, has antisocial behavior. Antisocial behavior meaning that they repeatedly hurt others. They are not very good with relationships. Good with They repeatedly lie and not in a good impulsive way. They act impulsively in a way to hinder others from excelling in relationships. And so that is the first personality disorder, antisocial personalities. Number two is avoidant. Sometimes this one can be mistaken for introvertedness. An introvert is just a person who is good socially, but generally quiet, generally consents or agrees with others a little bit more quickly than normal. Not necessarily, but just a little bit quiet and not too outgoing. But avoidant personality disorder, for it to become a disorder, it is a pattern of extreme shyness, a person who does not like to be in the group of others at all. They have extreme feelings of inadequacy. They feel less of others. They tend to have low self-esteem. I think that's their highest level of characteristic. They have high esteem issues. And this happens for a long period of time. Notice we're not saying this is not a one-off, it's a long period of time, that maybe for over years or over a period of months, they just generally do not do well when they're around people. They cannot socialize with you and until they know you like them and seriously like them. So that's a disorder. We call it avoidant personality disorder. Borderline personality disorder, these are people who have a problem sustaining personal relationships, whether it's between father and mother or boy and girl, or any other type of personal relationship. Even at work, they have a problem sustaining personal relationships. That's borderline personality disorder. A person with this kind of disorder may go to very great lengths to avoid being abandoned. Uh, you know, they feel less, and so they will fully rely on certain relationships. They can start, even hurting you just to ensure that you take notice of them and you maintain the relationship that they have with you. They will compromise a lot on their end to ensure they have a good relationship with you. Compromising a lot means even the areas that we consider as personal boundaries. So it's a person who has unstable personal relationships. Whenever you're in a relationship with them, you feel insecure, you feel they are hurting you, and their problem is mainly on personal relationships, not on anything else. Because when they are alone, they feel empty. So they only feel good when they're in relationships with others. So they struggle to maintain good personal relationships. That's borderline disorder. Dependent personality disorder, they fully rely on others entirely, cannot make their own decisions. They will allow someone else to make all the decisions for them. And this is all the decisions. They fear to take care of themselves. The people with this kind of disorder, the dependent personality disorder, they have difficulty making a simple decision like what to eat at breakfast time. So as an easy example as that, they have a problem, a problem on which vehicle to pick at a stage. They feel they are making the wrong decisions all the time. Remember, this needs to happen at every stage of life, for a long period of time. So they have a problem making the simplest decisions and even the most difficult decisions. So that's dependent personality disorder. Histrionic, it's a pattern of excessive emotion and attention seeking. A person who can even hurt you just to draw your attention to them. They'll hit you to draw attention to them. they they may use any form of techniques just to draw attention to themselves. And they have exaggerated emotions. When they're happy, they are too happy. When they're sad, they are too sad. Narcissistic personality disorder, it's a person who just likes to be admired. They draw too much attention to themselves. They are not sensitive to others around them. So they will hurt you, but a person will hurt you, or a person will hurt others, but they want, in doing so, they want all the attention to come back to them. Another characteristic is they are very entitled. They think everything should revolve around them. When it is their turn, for example, when they want to do something, they feel everybody should be involved in it. A person who basically all the time wants, they will never help you, but they always want you to help them. And this needs to happen. Again, I keep repeating, all these disorders are not a one-off. A disorder becomes a personality becomes a disorder when it happens over a long period of time, over a period of time. It's not a one-off. So the person always wants help, but will never help you. Whenever it's your time, they will always keep citing how they have certain challenges, and so they are not able to help you. That is narcissism. We call it narcissistic personality disorder. Number 7, obsessive compulsive personality disorder. There is a reason why it uses two names, because there is a different type of personality that can be easily compared with this one, but it's not the same. Let me first explain this one. Obsessive compulsive personality disorder. It's a pattern of too much order, too much perfection. It's a perfectionist. Perfectionists, to some extent, have a bit of positivity in them, that things around them are always organized, things around them are orderly. However, sometimes it could go too far, such that a person may be overly focused on their schedule. They are not flexible at all. They do not allow themselves to change their schedules even a little bit. I'm sure you have found such a person. The way they wash their clothes, the way they arrange their clothes, the way they wash that house. If you dare wash a certain part of the house before another, that will basically mean that house is not clean. Or the way they write, or the way they read. If they read a certain page before another, it basically means they have not understood. Or the way they eat in a certain kind of way, which if you change it, they will get seriously angry at you. So that is obsessive compulsive personality disorder. Now, I have highlighted here that this is not the same as obsessive compulsive disorder, what we normally call as OCD. OCD is an anxiety disorder, where a person has certain thoughts that make them feel to do things repetitively. These are thoughts, such that they will keep washing their hands, and if they don't wash their hands, they feel it is interfering with their personal daily activities. That is OCD. OCD is an anxiety disorder. It's not a personality disorder. They just have anxiety and you need to solve their anxiety. Yeah, that basic thoughts. The difference is that obsessive compulsive personality disorder is not a thought, it's an action. A person just needs their area totally organized in a certain kind of way. Organized in a certain way. So this is anxiety and this is basic perfectionism, basic orderliness. So that's the basic difference. In the end, they may seem the same because when the person thinks that way, they'll keep washing their hands, keep washing their hands. But in OCD, when someone is washing their hands or checking on things or cleaning things regularly, so a person is just anashinda akienda pahali the whole day. That basically does not mean their area is organized. But a person who has total need for organization, if you touch a pencil on their desk, that means you have disorganized everything. That is now obsessive compulsive personality disorder. Number 8 is paranoid personality disorder. It's an extreme state of paranoia. These people often assume others will harm or deceive them. So they have very little trust in others. They often think this person will lie to me, this person will deceive me, this person is untrustworthy. They have a problem creating relationships. That's paranoia, paranoid personality disorder. It needs to happen over a long period of time. It could be caused by many things. Maybe over their period of their life, they have felt that certain people, certain important people in their lives betrayed them in one way or another, and so they may behave in a way to ensure that that never happens again. So if they do so for a long period of time, they will develop paranoid personality disorder. They will have no relationship. They are always suspicious of others. Schizoid personality disorder is the next one. It is being detached from social relationships and expressing little emotion. There's something we had mentioned earlier, where a person is forming personal relationships but struggling to maintain them. This one here, that it's not the same. Let's just want to highlight the differences. We call it borderline personality disorder. A person will cling on to a relationship even if it's hurting them. They will cling on. That's borderline personality disorder. It is the best example of that is someone kidnaps you and then borderline is someone kidnaps you and then someone kidnaps another person. You've seen in movies, a child is kidnapped. They stay there for 10 years until they start falling in love with their kidnapper. That's borderline personality disorder. But schizoid personality disorder, you find that the person expresses little emotions and they are detached from their social relationships. It's like the total opposite of borderline. They do not want any relationship with anybody. Almost similar to paranoid, but the reasons are the same. In paranoid personality disorder, a person does not keep relationships because they are suspicious of others. In schizoid personality disorder, a person does not keep relationships because they have little emotions to keep those relationships. You need balanced emotions to sustain relationships. So a person with schizoid personality disorder typically does not seek close relationships, chooses to be alone, and seems not to care about praise or criticism from others. They do not care about correction. They do not care about compliments. They do not care about anything. And so they will not keep relationships. See, relationships are characterized by emotions. And so that basically becomes a problem. And number 10, schizotype. Schizotype, personality disorder. It's a pattern of being very uncomfortable when you have relationships. A person, cannot even sit next to others because they just need their personal space. That's schizotype. They do not sit close to others over a long period. It's not a one-off. I keep repeating that. It's not a one-off. So over long periods of time, they do not want to sit near anybody. They don't want any close relationship with anybody. They are okay on their own. They have distorted thinking and eccentric behavior. Eccentric behavior is peculiar behavior or speech that may have a bit of anxiety associated with it. So they are very uncomfortable with relationships. Basically, as people who are doing community development, you'll be faced with these issues by people with these issues. And the first thing you need to do is diagnose their history. That's the thing you need to do. You need to check out someone's history. Where did it start? Dig as deep as possible so that you can correctly diagnose what the person is going through. Find out the history. Go back all the way. The most accepted theory I have mentioned is where our lives are affected by our past. Our lives are affected by our past, positively or negatively. It's affected by our past. So we can choose to become like our past or choose not to become like it. So we will be affected positively or negatively. And so whenever you're faced with any one of these disorders, check two things. One, the history. Number two, how long has it happened, so that you can correctly diagnose it. Development disabilities is the next section, and as a key section of our learning, these are conditions that are physical conditions of impairment. Maybe a person does not learn, does not understand things quickly, a person has problem speaking, has challenges with their speech, a person behaves differently from others. Sometimes it could be caused by their development. The causes could be the following. I've just highlighted a few. One of them is maternal infections. At least 25% of hearing loss among babies is due to maternal infections. So when a person was expectant, then there were certain infections that occurred. The other one is fetal alcohol syndrome. When a mother is using alcohol during pregnancy, it can result to fetal alcohol syndrome, which causes brain damage in excess in extreme cases and or growth problems in mild cases. Genetic and chromosomal conditions, some chromosomal conditions of imbalances in chromosomes during the fetal formation, infections during pregnancy in extreme cases. Maybe some of them could be caused by undercooked food, contaminated food, or mother-child transmissions. Then autism, we know autism. Children who suffer autism, they are also, it's also a development disorder. That's a cause of one of the development disorders. Premature births, low birth rate, low birth weight, premature birth, multiple birth. That is multiple birth is when you have many children, you get maybe twins or triplets. Sometimes they could face certain challenges, and it's one of the development disabilities. And then untreated newborn jaundice. Jaundice is high levels of bilirubin in the blood during the first few days after birth. When it's untreated, it causes cerebral palsy, hearing problems, vision problems. So these are just but a few, and you can find more in the references provided here. Intellectual disability is another area we need to cover. Intellectual disabilities are a term that used when there are limits to a person's ability to learn at an expected level and function in daily life. So their learning is impeded. They do not understand things quickly. They comprehend them very slowly. They do not synthesize information the way they are supposed to. They do not understand what you're telling them. They have a challenge. Because of that, they have a challenge speaking or walking or dressing. They cannot entirely rely on themselves. And so we find them physically challenged. So signs of intellectual disability, and it could start anytime before 18, a person is 18 years. This maybe could be the inability to learn. One of them is the inability to learn or to reason on themselves, the inability to solve problems, the inability to have certain skills like running, which other children have. Adaptive behavior, which includes everyday social and life skills. A child could adapt certain behaviors which would cause their impediment to growth intellectually. For example, when you notice a child is having trouble understanding social rules, and then this is not addressed, at a young age, slowly by slowly, they will start to have difficulty in following rules. As we have learned in our class this semester, that is a problem and that is a challenge, and then that will cause intelligence problems. Abnormally development milestones, um, that's another sign that a person is suffering, maybe intellectually, and this needs, I need to highlight the word abnormally, because late child development of milestones, maybe sitting, crawling, walking, speaking, it's basically normal. But unless it happens such that the person is at an advanced age, and something you would consider an advanced age for a certain milestone, and it is yet to happen, unless they are well advanced or they skipped it, maybe they just skipped crawling and just walked, then that is not um, a development issue. But if the person has not walked, not crawled, and they are maybe 5 years, 4 years, then that's totally abnormal. We are not in a science class. We are trying to just define the symptoms. Your work in such a setup would be to identify and direct them. Identify the problem and direct the child, direct the parents, direct the guardians to the right facilities for them to get treatment. Loss of memory. If a child has a lot of loss of memory, they do not remember things quickly. They do not remember things at all, actually. They do not have any memory of what they did. That's another sign of intellectual uh, development being inhibited. So that's it. Unless there's a question, I wish to stop there and encourage you to remember to answer the questions in the discussion forum. Do you have any questions? Any questions? Okay. If there are no questions, then I wish to end the meeting there. You can go ahead and answer the questions in the discussion forum. Remember, they close by 2 p.m. Thank you and enjoy your week.